The prosecution will call more rebuttal witnesses in the Lindsay Clancy trial today. The Massachusetts mother admits to killing her 3 children, but the defense says she's not criminally responsible because she was suffering from postpartum psychosis. Prosecutors say the act was planned and deliberate. Now the case has many taking a closer look at postpartum psychosis. Columbia University psychiatry professor and former American Psychiatric Association president, Dr. Jeffrey Lieberman, is here for more on that. Hi, Dr. Lieberman. Thank you for coming on.
Good morning, and thank you, Diane.
So, a psychiatrist for the defense on Friday said Clancy showed bipolar symptoms, but a forensic psychiatrist for the prosecution says he thinks Clancy had a depressive episode and isn't bipolar. You haven't treated Lindsay Clancy, but what difference would that question make to the larger question of whether she experienced postpartum psychosis or not?
Well, it's a little bit esoteric to be arguing over whether she had a postpartum mood disorder, and the whole situation, this tragedy, was eminently identifiable and preventable. The difference between depression and bipolar disorder is that bipolar disorder is a condition which more readily involves the inclusion of psychotic symptoms than just a postpartum depression. But the two limiting factors here are, one, how much information diagnostically did the clinicians elicit to identify the fact that this woman was rapidly increasing the severity of her symptoms from a mood disturbance where she was feeling sad and down and pessimistic and ultimately suicidal to having psychotic symptoms of delusions. They did not elicit that sufficiently, and they did not institute the right treatments for the right doses for long enough to treat what ultimately was probably what impelled her to these actions. But the other issue, Diane, is that psychiatry has some exceptional aspects to its knowledge base and its practice. It's not like the heart or the lungs or something. So if somebody complains of chest pain, the cardiologist will do tests to determine whether the chest pain is the source of it is the heart and what is the particular problem. When somebody has a disturbance of their emotions or their thinking or their perception, psychiatrists don't have the same kind of technology which can look into the person's mind and verify exactly what's going on and what is the nature of their thoughts. Are they false beliefs and delusions, or are they just some type of plan that they have to commit some kind of surreptitious or illicit act? In this case, in most cases, which I've seen many of, unfortunately, I think that Lindsay is more the victim than she is the perpetrator of the crime, because once you're in the throes of a psychotic episode, you're under the influence of your symptoms, and the internal reality of your mind becomes the external reality that you believe is real. So she was compelled by her delusions, or if she was having command hallucinations, to do this, and she didn't know any better. She thought the devil was going to possess her children, and she was acting in the best interests of the family and society. Unfortunately, that's not true. But this is not an uncommon phenomenon. I've seen many cases like this.
We've heard from Clancy's ex-husband and family saying she tried to get help, but you say there were apparent gaps there that we can learn from. What do you mean by that?
Well, there's several very, very telling hallmarks of a person's beginning to develop and experiencing a postpartum mental disturbance. One are the symptoms that they have, but secondly is their past history. So did she have any past psychiatric history? Well, it's not clear, but there's nothing that sticks out as a formal history of a diagnosis, hospitalization, and treatment. Then did she have postpartum mental disturbances with her prior 2 children? And the testimony, at least that's been reported in the media, is unclear whether she had anything that was real. And then the third thing is, did she have a family history of any mental disorder, and particularly a mood disorder and bipolar disorder? And to my knowledge, that has not been elicited and reported in the media, so we don't know.
All right, Dr. Lieberman, thank you.